Happy to have Douglas Goldstein from Medcurio join us. Doug, how are you?
I'm fabulous, and it's great to be part of HITLAB. And I just can't believe it took us 25 years to begin working together after publishing the first book globally on e-healthcare and the promise to improve healthcare. Fast forward, it's a pleasure to be able to actually work with you with HITLAB and what you've created here. And it's also a pleasure to be able to work with Buzz Stewart and Krista Bruce and Krista Wilson-Jones, who are co-founders of Medcurio, because they have created what I consider probably the most significant transformational impact that will enable all the AI digital automation solutions being created by your network and beyond, really to work in real time with EHR and other data.
It's fantastic. And you're going to be at the Innovator Summit during New York City Health Innovation Week, the week of May 5th. The summit's going to be Times Square, and talk a little bit about how your platform, really this kind of no-code access real-time EHR platform, Venue is going to actually accelerate this kind of access to healthcare, reduce costs, and improved overall quality through this kind of novel model you guys have built called this trustworthy AI automation scale.
So Medcurio's platform is called Venue, and Venue has the ability to access all data inside of an EHR. And Epic is a series of application layers, and the core EHR is from a company called InterSystems Cache. So we can access all 90,000 data elements through one endpoint in real time. So it's an unbelievable breakthrough, and it is far superior to vendor APIs, FHIR, HL7, which are the current mechanisms of accessing data. Those were never designed to access health data, EHR data in real time. And so the team that I work with, Buzz, Krista, and Kristen, they spent 16 years at Sutter and Geisinger trying to automate healthcare with digital and AI and different approaches. But they were unable to, so they left and they formed Medcurio, Medcurio.com. They formed Medcurio, and then through their own money and then partnering with the AMA, American Medical Association's Health 2047 Venture Studio, which also has silent funding from United Health Group and the founders' money, they created Medcurio and Venue, which accesses all data, which is not possible. So what took them 6 months to do can be done in days and weeks using the Venue platform.
It's incredible as patients begin to see, when they're going into a hospital system, they begin to see just how complex the IT infrastructure, the workflow is within hospitals. It's really extraordinary to see how it's important to have something like Venue there to help change that and improve that workflow. From what you're seeing, from where you're deployed today, and again, just for our audience sake, this is something that's actually working. This is not vapor, and it's going to be at the summit, so you can take a look at it in New York City Times Square, like Richard Hanbury's Sauna model and the solid glasses from Neil, and that's curing blindness for some folks. How is Venue changing the conversation for hospital leaders and health system leaders today?
Let me give you one specific use case. So Venue is infrastructure, and we're building solutions to operate across the entire health system process. So one use case, one of our major health systems, Fairview, replaced the vendor APIs for their patient portal, of which they were paying $1 million a year to access their own data, my data as a patient, within their portal. One use case, they saved $1 million. The platform is extremely affordable. It's an annual license fee, and it erases all data access charges. So the value proposition for a $6 billion health system across 10 priority use cases is roughly $200 million in financial impact, increased revenue capture, improved revenue cycle management. And now, more importantly, we are partnered with Salesforce. So Salesforce, and we're adding 10 additional health systems through our relationship with Salesforce. So Salesforce has generally just been used for patient acquisition. What we do is now allow, and it's been difficult to use it for scheduling, care coordination, referral management, care gap closure, because of the difficulty and the time and the cost in accessing data. We erase all that. So with real-time access through a very affordable, cost-effective platform, now Salesforce can work its true customer relationship management to support patient support across the continuum, along with overall population health. So that $200 million impact with all the health systems looking to save costs is really important, because we cut costs, but we don't cut clinical costs. We allow care teams to operate at the top of their licenses.
Yeah, I think what's nice is that we got about a minute left. What's really nice for our audience to understand is that, a lot of the apps and a lot of the wearables that you see when it comes to digital healthcare, remember, digital is all about the data from the human being and around the human being. It's not just apps and devices. It's anything from electronic health records to infrastructure to biomedical informatics, metabolomics, exosomics, et cetera. When you look at Venue, what they're doing, and this is to the audience, it's about the ability to accelerate data exchange from 1 to 2 weeks via Epic to 1 to 2 hours, 1 to 2 days via Venue. And that's a massive change for improving quality for patients, improving access for patients, and reducing costs and increasing revenue for health systems. So now I need to know, just for the audience sake, Doug, you guys are on the App Exchange, which for people that don't know Salesforce, that's like having an app on the App Store versus not. And so now any hospital system, which is most in the US, can just use the App Exchange and dial into Venue very quickly. But while you're doing this, what are you seeing? Is it improving outcomes? Is it improving revenues? Is it reducing costs? Is it reducing the overall cycle time? Where's the biggest value proposition in your platform?
It's across all of them. This is infrastructure. We're not a point solution. We are a comprehensive infrastructure, and we're creating the solutions that will make it even faster. So it's like downloading, we operate inside the health system. It's like downloading Microsoft Office, and you create the documents and the whatever you want. But we're going to create a set of solutions that can also decrease the time to market. So we save money, we increase revenue capture, we improve quality, we improve patient care, we decrease clinician burnout, because we're truly a mechanism to automate and access all data inside the EHR in real time without toll charges. I mean, the entire industry spent billions of dollars, but they agreed to pay toll charges or data access fees to access patient data. It doesn't make any sense. So we're going to break down the walled garden, and this will be the new standard of patient data access with my futurist hat on in 3 to 5 years.
Doug, thank you for joining us today, and looking forward to seeing you in 2 weeks at the summit.
Great, thank you.